Hello everyone, I'm SandeepJoshi from India. My business idea is called NearDoc. This business is based in India. Let's see what is it about. This is Rahul. He's from here but has now moved here for work. He and his wife need to see a doctor but don't know any good ones in this new city. So they search online and now they are more confused. There are hundreds of doctors, but which ones are really good? There's also a big hospital nearby, but that is always crowded and so expensive. And here's Dr. Sharma. He practices in the same neighborhood and is very good, but he has no time for marketing his practice and doesn't know much about internet presence. He sees over 50 patients per day but doesn't use any software to manage his practice. He's also worried these days because his patients are moving to big hospitals. Enters NearDoc, your clinic on your phone. NearDoc connects patients with their neighborhood doctors and acts as the core of all doctor-patient interactions. It's a complete health app for the patient and a complete practice management suite for the doctor. So what does NearDoc do? It is your same friendly neighborhood clinic with one amazing difference. Our doctor is always where you want him to be, right in your neighborhood, even when you move to another city. The NearDoc platform has two modules. The patient module allows you to search for a doctor, book an appointment, do consultation, and even get your lab tests done and medicine delivered right at your home. It also stores your health records for the future. The doctor module gives the doctor visibility in his schedule, provides electronic prescription screens, billing and reporting options. NearDoc sets the system at the doctor's office for free and makes the practice digital and high-tech instantly. All doctor-patient interactions then happen on the NearDoc platform, safely and easily. Here's our business model. NearDoc approaches private practice doctors to become part of NearDoc network. The doctor gets the NearDoc suite for free and gets full marketing support, and obviously the visibility and additional patient traffic by being on the NearDoc network. We carefully credential and curate all doctors who join the network. Patients can then simply search for a doctor and book a visit through NearDoc app. When they visit a doctor or do an online consultation on the app itself, all interactions, including the prescription, happens on NearDoc platform. Patients can pay for the services digitally and can even get their lab samples collected or medicines delivered right at their homes. NearDoc uses a partner network of pharmacies and labs to facilitate these home services. NearDoc makes money by charging the doctor a fee for every appointment coming through the app. Another revenue source is a percentage revenue share from the pharmacy and lab partners. We plan to promote value-added services to our patients to make additional revenue. We can also monetize via analytics with the disease data on our platform. The private practice market in India is huge but completely unorganized. For our analysis, we are considering the 100 biggest cities in India and people in the middle 60% of the income pyramid there. There are around 100,000 doctors in this market, and our analysis shows that the market size is more than $7 billion annually, and this is just the allopathic doctors. If we consider Ayurveda doctors as well, the market is well over $10 billion. Here's what is unique about us. NearDoc is like a multi-location clinic chain, but completely digital. Our competition comes from two types of players. The brick and mortar players who run their own clinics. There is no success story so far in this space, and the current players are struggling to reach scale. Even the largest player has only 75 clinics across India. These clinics are expensive to build and slow to reach profitability. The online players are mostly focused on doctor search and appointments. None of these players facilitate the actual treatment interaction between the patient and the doctor. Since NearDoc is present both with the doctor and the patient, it goes far beyond the competition as a complete primary care solution. We have already done some market research by talking to over 50 private practice doctors and hundreds of patients. We have the detailed product specifications ready and have a great core team in place. If we win, we plan to utilize the money for developing the mobile platform and running a pilot in India. And this is what we plan to achieve in next 3 years. We want to reach 1,000 doctors and 2 million patients and become profitable as a business.